Now, the Northwest Department of Health is today expected to release a report on the cause of a fire at the Christiana hospital. The fire ravaged the healthcare facility just before the completion of a 100 million rand renovation project. Our reporter Bafedile Moerane joins us now to give us the latest on the health authorities' visit this morning. Bafedile, very good morning to you. Thank you for joining us. Of course, a lot of concern around the Christiana hospital and some questions still looming. What did you find?
Well, we are still waiting to hear from the MEC of Health in the Northwest, Madoda Sambata, this morning, where he will be briefing us as the media and also the residents of Christiana as well as the workers of this particular hospital, who last week we engaged and saying that they are left on their own or left in limbo to see how they render services to the residents of this particular hospital. And quite interestingly, when we arrived here at the hospital, we find this man by the name of Mr. Buota, who is also the resident here, complaining about the poor service that they are receiving since the ban of this particular hospital, and they're saying that they want answers from the authorities as to what is it that they have to do as residents, because they've been struggling for quite some time. Mr. Buota, thank you so much for joining us. What is it that you want to see happening, basically? Because we find you here as one of the residents who came this morning to hear from the authorities in terms of the progress and restoration of services.
Well, first of all, the MEC says he's going to deliver 50 beds here today, right? Now, my question is, as you can see behind us, the hospital is burned down. Where does he want to put the beds, right? Then we've got the town hall with a boardroom and very few people. And we've got at the back of the municipal building, we've got space to move the whole municipal staff there, right? And why can't we turn this whole municipal building into a temporary hospital until the hospital has been built? You know, that's my point. Then, secondly, for months, people were sitting there, their temporary structures, né? They were sitting there, just sitting there every day. They were going to build a new hospital. Where are they now? Where's the money? The money apparently was paid for the building. They're gone. They're all gone, right? But my point is now, the people in this town struggle. They've got to pay 24 rand for the taxi from the location to town. Then they've got to pay 24 rand back. How can somebody who lives maybe on Sasa afford that, right? Why can't we turn that empty municipal building into a hospital? Then our problem is solved. Okay, now he says, like yesterday, I personally saw 3 brand new ambulances coming through, right? Now, let's say he's got the 3 new ambulances, okay? But we've got 20 people that's got to be hospitalized. Is he going to leave half? Which one? Is he going to choose which one's going to die and which one? Who's going to make the choice? Ne? To take it to other towns. We have fantastic, capable hospital workers. Real good people, qualified, ne? All these years. Why can't we just take 50 beds into the municipality and make that the hospital until this hospital has been built? That's as simple as that. The community is sick and tired of this nonsense. Ne? We can't go on like that.
Well, thank you so much, Mr. Buota. Then, of course, you hear the frustration from one of the community members who is here actually to hear from the officials as to what is the plan, because really they're saying that they're struggling, having to travel, you know, over 60 kilometers to areas like Vryburg, to areas like Bloemhof, you know, to get health services there. So we will hear from the MEC, Madoda Sambata, there as to what exactly is the cause of this particular fire, just, you know, after the renovation of 100 million rand 3 months ago in September. And also we are expecting him to deliver some beds here and you know, some of the things that should be used here, yeah, to service the residents of this particular place called Christiana. But now the question, as you hear Mr. Buota asking, that where are those things going to be placed, because this particular hospital, it is still banned. So we will hear some of those things from the authorities, and they're also going to deliver about 3 ambulances that will also help in rendering health services in this particular area.
Very well, Bafedile, let's leave it there for now. A lot of questions, very few answers. Of course, we're hoping to get some clarity a little later on. Bafedile Moerane outside the Christiana Hospital in the Northwest.